Yeah, sure. So I live in a lovely part of the world, in near Tewkesbury. We're right on the edge of the Cotswolds. I'm a junior member of medical physics team at a department in the Midlands, working for the NHS. My specialism is radiation safety. I qualified as a clinical scientist last autumn after a 3-year training period. The training scheme which I followed is called the Scientist Training Programme, or STP, and they're always on the lookout for bright and motivated candidates. There's an annual intake, and trainees study for a master's degree in parallel with on-the-job training. The scheme takes in candidates to train for all kinds of scientific disciplines within the NHS, including medical physics, also engineering, informatics, for example. During the lockdown, our medical physics services were partially suspended, and a few members of our team, including me, were seconded to the intensive care unit. One of the 4 wards in ITU was dedicated solely to COVID patients. At the height in March, the ward was extremely busy, and fortunately for me, I joined a few weeks after the peak when patient numbers were considerably less. Our job in ITU was to supervise and help staff donning and doffing their PPE. As you know, the disease can be very dangerous for some, and the PPE was essential for their protection. Radiation safety specialism within medical physics works to ensure people are safe from radiation sources within the hospital. By people, I mean 3 groups. Those are patients, staff who work with radiation sources, and everyone else, be they staff, patients or general public, who are in the hospital or around the hospital but have no direct involvement with those radiation sources. And by radiation sources, I mean X-rays, such as CT machines, radionuclides, and non-ionising sources such as MRI, ultrasound and ultraviolets. The machines themselves are tested regularly to prove that they're working safely as intended and giving off the minimum radiation required for good performance. The rooms and buildings which house the radiation sources are designed to attenuate as much radiation as possible to protect those outside, and we get involved in the design of those facilities. We also monitor staff routinely for any dose of radiation received. And so essentially we're helping the employer, the trust, to comply with key pieces of legislation which are concerned with the safe use of radiation. None of the requirements for radiation safety have changed. However, the way we work has changed. At this time now, most of our services are back to full capacity, but most of our staff are spending much more time working from home compared to the pre-COVID time. We're taking as many steps as possible to minimise the chances of our staff transmitting infection or becoming infected themselves. The current way of working probably won't change much for the next, say, 9 or 12 months. My personal hope is that some of the changes will become permanent. By allowing staff to work from home, you give them considerably more flexibility, you can save their time, that results in happier staff, better morale and better staff retention. Perhaps more importantly, it's having people working from home significantly decreases the environmental impact from our business activities. Personally, I hope it continues because I'm currently saving hundreds of pounds per month and probably around 40 hours of my time per month by not commuting. I did a midlife career change, and by that point in life I had a fairly good idea of exactly what I was looking for in a new job. I knew that I wanted to be able to use my technical and scientific skills, have a good amount of variety in my work, good job security, and also opportunities to develop myself further. I was also looking for something that offered a salaried training scheme, because there's no way I would have been able to afford to self-fund through another 2 or 3 years of university study. So medical physics offers all of those. And now it's 4 years on from commencement of training, I remain happy that I made a good decision. But being seconded to ITU had the advantage that you could more directly see the benefit of your work to the patients. In medical physics, sometimes that link is a little tenuous. So several years ago, and for several years, I worked as a skipper on a river pleasure cruiser out of Tewkesbury. It was a lovely job. It was obviously in a beautiful environment on the River Avon, and met some really interesting people. However, the work was seasonal and part-time, and it wasn't making much of a contribution to the mortgage. However, it's something I would like to go back to later in life.